So on the booster front, the question here is, what are the latest recommendations? So we did have an update in the US, and there are 3 groups that should be thinking about shoring up their immunity with a booster. The first is adults 65 and older. If it's been 4 months since the last dose, you are now eligible for another bivalent booster. People who are immunocompromised after 2 months or more since your last booster, but in consultation with your doctor. There's a big part of these guidelines is to give more power to the patients and in consultation with their doctors to make a decision that fits them. So you are also eligible for another bivalent booster. And people age 6 and older who have not yet received any bivalent boosters. So if you had a monovalent booster but not a bivalent, you are also encouraged to go get a bivalent booster. And on the flip side, there are no further booster recommendations for people 6 and older if you've already gotten an updated mRNA vaccine. So unless you're in one of the previous categories, over 65, immunocompromised, no further boosters recommended at this time. And for younger children, multiple doses continue to be recommended and vary by age and vaccine and which vaccines you received previously. One last thing to note is that the monovalent mRNA COVID vaccines are fully retiring, and the US is exclusively switching to mRNA vaccines. So in general, those nerdy girls are pretty happy that these guidelines are a little more permissive and give more choice to vulnerable people and their clinicians. And we think that, likely things are heading towards something similar to a flu shot where you have an annual cycle with, again, different strategies for people who are more vulnerable. This is a similar approach in places where I am, in Canada, and other countries.